Rebecca Markson uses she, her, hers pronouns, and she's a family medicine resident physician at St. Luke's University Healthcare Network in Easton, PA. She's a proud member of the LGBTQ plus community and has dedicated a lot of her time in residency towards researching health disparities that impact the LGBTQ community. She's also active in educating fellow healthcare providers, I know because I've been on those calls, on how to create safe and inclusive spaces for LGBTQ patients. And upon completing her residency, her goal is to complete a fellowship in LGBTQ plus healthcare. And that includes providing specialty care, including affirming care for the transgender community. So tonight, she is going to be talking about accessing trans-affirming healthcare and becoming your best own patient advocate. So welcome, Dr. Markson.
Thank you, Corinne, and thank you guys so much for having me. I'm so happy to be here today and talk to you a little bit about how to be your own healthcare advocate. So next slide.
There we go.
So disclosure, so I have no financial conflicts of interest to disclose. I'd also like to disclose I am not a professional. I am a professional patient advocate in some sense, but there are people whose professional role it is to be patient healthcare advocates. I do have some personal experience in healthcare, being a second-year resident. I hope I have some good insight to impart to all of you. While I personally don't identify as transgender, a lot of people that I have close to me, family and friends, identify as trans. And as Corinne mentioned, I am a member of the LGBTQ community. So it has become a passion of mine to really do everything I can to educate myself and others on how to make healthcare a much more welcoming space for us. Anyway, next slide. So our goals for today is to do kind of exactly as the title of my presentation is. So learn how to advocate for yourself in healthcare so you can take control of your health. And we'll also focus on not only just general ways to advocate for yourself, but also I will touch on obviously some trans-specific issues. Next slide. So what exactly do I mean by health advocacy? What does it mean to be a health advocate? So there's an actual term called health advocacy, which are the activities related to ensuring access to care, navigating the healthcare system, mobilizing resources, addressing health inequities, and influencing health policy and creating system change. So it's pretty broad, but essentially the purpose is to help enable access, patient access to care, make sure that access is equitable for all people of all different backgrounds. So there are professional healthcare patient health advocates, but as I mentioned earlier, there are informal healthcare advocates. So like myself, as a physician, I try to advocate for my patients in the best way possible. While I'm not necessarily doing policy change, anytime an issue arises in a patient and the patient needs help, I'm doing the best I can to make sure that my patient is getting the best care that they need. So what does it mean to advocate? So to support or promote interests or cause of a group. So overall, what do I want from all of this is that while there are professional roles, you yourself can do a lot of these things to make sure that you are standing up for your health so you're getting the best health care you need. Unfortunately, as you know, the system has generally not been kind to the LGBTQ community. The healthcare system has depended a lot on social, cultural, political context, and it can definitely change throughout the United States. We are thankfully doing better, but I definitely want to make sure I help address how you can best advocate for yourself. The unfortunate reality is, according to the United States Transgender Survey, and I hardly need to spit out these statistics. I'm sure you all have experienced this, but 50% of transgender individuals end up having to teach their providers about what it means to be transgender. And, part of the problem is there's not great education currently. So according to the Journal of the American Medical Association in 2010, there was less than 40% of medical schools were providing transgender related content, which is very unfortunate to hear about, and could also, explain why there is such a profound gap. So hopefully I can help you understand a little bit more about the healthcare system so that, you can take the best advantage of the healthcare and get the healthcare that you need. And just remember, the only one looking out for you is you and your providers if you're having a great relationship with them. So anyway, next slide. So why is it important? It can be very empowering because you're not just depending on the system, but you're taking your own stance and making sure that you're getting the things that you need. And again, this helps you achieve your goals and ultimately optimize your health. The better and more honest relationship you have with your providers, the more you ask for yourself, the more you will get. Next slide. So what are some key ways to be your own health advocate? So I generated kind of the top 6 categories that helps you be your own health advocate from, asking other providers. Forbes has a great list, and UPMC has a great list, and kind of just summarized everything I found and everything that I've learned and that patients have told me has helped them navigate the healthcare system. So we'll go over how to be prepared for a visit, how to increase your knowledge and awareness, how to develop and maintain organization, find your community, speak up for yourself, and ultimately not to give up. Next slide. So first we'll go over how to be prepared. Next slide. So to understand what to ask for or how to make the most of your visit, I think it's helpful to know what are the components of your visit. So typically when you see a provider, you have limited time. Oftentimes, depending on who you're seeing, it can range from 15 to a maximum of typically 40 minutes. And in that visit, obviously you're taken back. Usually they get vital signs. A medical assistant or nurse might get some past medical history, your medication list, surgical history, etc. But then your time with the provider ends up being limited. So because you have such a short period of time, it's important that before your visit, you have an idea in mind of why you're there and what you want to get out of that. So what can you do? So bring in healthcare information, documents, and resources. This is especially important, the first time you're seeing a provider. So what I'm going to ask, or what medical assistants are going to ask, are going to be your past medical history. So what does that mean? So if you were diagnosed with a condition, what that diagnosis is, when you were diagnosed, how you might have been diagnosed, whether it was on imaging or whatever that may be. What treatments are you on for it? Sometimes, depending on the condition, providers might want to know, what have you tried for it in the past and why didn't it work? That will help, down the line if, the medication you're on doesn't work, what they shouldn't try again or what they could maybe try again. Surgical history, kind of the same thing as past medical history. When it was done, where it was done, who did the procedure. Having all this information will make it easier, for your provider to, if there's any concerns about surgery or how things went, or a provider wants to follow up, it'll be good to have all that information so your provider can directly contact those individuals and ask for that information. Allergies, your provider is going to want to know what you're allergic to and what that allergy is, and substance use history. Even if you're not using anything now, what you've used in the past, for how long, and what you were using. This can often take a lot of time, like in the first health encounter, but once you have all this information and it's in your electronic medical record, it will stay there, and then it'll be easier to follow through afterward. One thing that you can do, especially, you don't know if you're going to live in the same place forever, you're going to move around. It's good to just have a Word document that has all of this information that you can print out and bring to other visits, or if you see a provider in one network and maybe another network does not use the same electronic medical record, this way it's easy for you, and you don't have to kind of talk through everything again and again ad nauseum. You can have this paper, bring it into your provider for your first visit. They can plug in all this information and they can be ready. Another thing that will be helpful is bringing the name and information of your transgender healthcare provider. I think this is really important because one thing that can be lost in medicine these days is interdisciplinary communication. So, meaning, what do I mean by that is communication between your healthcare team. So your transgender healthcare provider might not be your primary care provider, but if your primary care provider is maybe new, is not familiar with hormone treatment, it will be helpful for them to know their information, because they can contact your healthcare provider and your trans healthcare provider and say, what should I be screening for? That person can be a good resource for your primary care provider so that they can provide the best care for you. If your primary care provider is not as well versed in transgender affirming hormone therapy, there are plenty of free and accessible resources, and you can write any of these down. There's the WPATH, which I'm sure you're all familiar with. It's the World Professional Association of Transgender Health. They have a whole standards of care guideline that is free PDF online, and it's actually a good resource for you as well if you're interested in learning more about your treatments and what to expect from therapy and providers. There's also the Fenway Institute, which provides free education, and one way to maybe encourage a provider to take advantage of these resources is that they do provide something called continuing medical education, which all healthcare providers have to do once they graduate from residency. They have to fulfill a certain amount of CME credits per year. And I don't think it's that difficult to ask for a provider to do this because, again, it's needed. And two, there's always going to be something new that your provider has to learn about anything in medicine. So I think it's okay to encourage your provider to educate themselves if you don't want to educate them completely yourself. Next slide.
I think a great thing too is that, in the end, every physician in one way or another is in business. And, whether you're,
yes.
you're hanging up your own shingle or you are working for a large healthcare network, is an individual provider, you have to be able to, bring revenue in. And, I don't know any physician who wouldn't want to get more referrals. And if you're working for a large healthcare network, they are looking to see how many new patients they acquire because they get paid more for a new patient. So if you talk to your provider about the fact that, 100 other trans folk in the area, like I do, who wouldn't want to get all those new patients, and ultimately, HRT care for trans people isn't a whole lot different than HRT care for cisgender folks too. So, yeah.
Right. I mean, the amount of hormones in some of the hormones for transgender women is like almost the equivalent of what's in like an oral contraceptive pill, which we prescribe all the time. Okay. So write down what you need. So write down what you want to accomplish out of your visit. What goals do you have? Whether that be to figure out why you have a constant runny nose, or you want to learn more about, a surgical procedure that has been recommended to you. Whatever it may be, write it down. You can also write down your concerns. So one thing, especially for like an acute visit, is there's going to be a certain set of questions that your doctor is going to ask from you when you're coming in, saying, having a new symptom. They're going to want to know, when did it start? What happened when it started? How long has it been going on for? When are you having those symptoms? Anything make it better? Anything make it worse? Where exactly is it? What have you tried? Have you had this before? If you look up online, the acronym that medical students are taught to use to get a history is called OLDCARTS, OLDCARTS. You can always look that up. And that way, when your doctor asks, tell me what's going on, you have everything ready for them so that they don't have to ask. Even it is their job, but this helps it make sure that you're more efficient in describing, and then your doctor is much more efficient in being able to provide their impressions for you. And I'll tell you this, anytime I have patients who take notes and bring in exactly what they want, they definitely get the most out of their visit. And I've found that it's incredibly efficient. And again, it'll help empower you in having a better understanding of what's going on.
Yeah, I'll just interrupt there again, because my spouse is a family practitioner, actually.
And, wonderful.
Yeah, and so one of her pet peeves is, when she gets done with, she only has 15 or 20 minutes, allocated per patient by her employer. But, she gets done with her 15 minutes talking about, your runny nose or your sore throat or your whatever you're there for. And then at, minute 14 and a half, somebody says, oh, by the way, I have a boil on my leg. Can you lance that for me?
Right.
Frankly, it ruins her whole day, because she has to still work on trying to treat you or satisfy you, but now she's going to run late with all of her other patients. And so
Yes.
if you have that list and you kind of hand it over at the beginning of the visit, things work much more efficiently.
Yes. And, another thing too is, rest assured, there's always time for a follow-up appointment. One thing that I like to do, and that would be helpful in you handing the sheet over, is you can only, so this goes with part of setting up expectations, you only have 15, 20 minutes. What's the most important few things that you want to address in your visit, and what can wait for a future visit? You might say, I definitely want to make sure I address this. I want to address this, but it doesn't have to be at this visit. But if we have time, can we talk about this? Your provider is going to be very happy if, you're so organized like that. So set up other expectations to set up is that, remembering that there might be a lack of education. It doesn't necessarily mean that your provider does not want to learn or become more educated in trans health needs. But that being said, you shouldn't have to compromise if, a provider seems to be unwilling or not unwilling to put in the time or effort to try to learn more or to hear you out. Another thing to have your expectations set up for is that the electronic medical record may vary from system to system. I can speak for St. Luke's in that, we do try to get a name, a preferred name, and gender identity. So if your legal name is not changed to your preferred name, your legal name does have to remain in the chart in some capacity. So if someone uses your name incorrectly, keep that in mind, that might be a reason, and it might not be intentional.
So here's a question from an audience member, and you may or may not be able to answer this one, but if you go to your doctor and you use your preferred name, does that information go to the insurance provider? In this particular case, they feel that their insurance provider is not trans friendly, so they want to make sure that they don't lose their insurance.
That's a good question. I don't think so, but I can't say that with certainty. So I know in our chart, it'll at least say it so that the provider can see So like it'll say like the patient's like first legal name, and then in quotations, it'll say their preferred name, and then it'll say their last name. But I don't think it changes what's on I think your insurance will still be the same. I think it's really just a signal to your provider. And you can always ask the administrative staff wherever, you seek care to clarify this.
Yeah, and I think that ultimately it's all tied to your social security number. So
Yeah.
every patient's assigned a number, and it's usually their social security number. So
yeah, because that doesn't seem like information that they share unless like your legal name is changed.
Yeah. But thank you very much.
Because then it would have to change on your insurance anyway.
Yep.
Okay, yeah, next slide. So next is increase your knowledge and awareness. Next slide. So understand your own health. So you can definitely research. It's okay to do that. Just be wary of some of the resources online. You can definitely go down a rabbit hole and, you have a cough and then automatically assume you have cancer. I don't want you to be too alarmed when doing research about certain symptoms, but there are reputable resources like the Center for Disease Control is pretty great. It has actually pretty understandable and comprehensive information about a lot of topics. In regards to, transgender health related information, as I mentioned before, WPATH details hormone therapy, preventative care, mental health services, and the Fenway Institute has a lot of information about a plethora of topics within the community. I think STDs, HIV, mental health, and they actually have a really fantastic webinar on legal issues as well that I actually just watched the other day. So you ask questions to understand your condition. So by all means, if there's something you don't understand from your provider, ask them. Ask, what does this mean? What are consequences? What can we do? That's what they're there for. Don't feel like you're troubling anyone and asking to understand more thoroughly. You can also ask them to print out information to go through, read it at home, and then come again, or call your provider, or some healthcare systems have ways that you can like write an email message to your provider. The more you know, the better you are going to be in control of your health. Knowing your medications is so important. I think every single patient should have a list of the medications they take, what they take them for, because anytime you end up in the emergency department or within healthcare, this is going to be one of the first things that they ask from you. And unfortunately, sometimes the electronic medical record does not always reflect the medications that you're truly on. So this helps make sure that you're taken care of in every single capacity, both at your primary care office, at whatever office you go to, and in an emergency situation. What might you want to know about procedures, medical conditions, medications, are risks, benefits, side effects, advantages, and disadvantages. So those are kind of like the 4 key things that you would want to know about your health. Next slide. So understanding your health insurance will also help optimize, the services that you seek and take advantage of. So there are so many different types of health insurances out there. Your health provider may not know what's covered by your insurance, and it's ultimately up to you to call your provider and ask what's covered. In speaking with one of my trans male friends, he was telling me that, policies for services can change annually. So for instance, you can call your insurance provider, ask them, what is needed to ensure coverage. And sometimes they can give you information that you can give to your provider. So for instance, I know you can call and say, what do I need to make sure I get coverage for gender affirming hormone therapy? And they can give you diagnostic codes, etc. Or what do I need to qualify for gender affirming surgery? And they can, again, give you diagnostic codes and what exactly is needed from your insurance provider to make sure that, you're not given a surprise medical bill because something's not covered. Um, Next, it's good to know your resources. So there's plenty of legal help that you can get. I know through Bradbury Sullivan, there's legal services available. There's also the TLDEF. I have an icon on the right, the Transgender Legal Defenses and Education Fund, that has plenty of information that you can go online. And then again, you can also contact your insurance provider to find more information. Next slide.
Yeah, I want to touch on the whole insurance code or diagnosis code because I personally had an affirming surgery not too long ago. I had an orchiectomy, and and it was very, I reached out to my insurance company, and their policy was very clear that it had to be a certain code that was used, and but there were like 10 different codes that can be used for orchiectomy. So if the doctor had used the wrong code, I would not have been covered. Because they used the right code, I didn't have to pay a nickel. So really important.
Yeah. Also, know your rights. So there are non-discrimination protections that can protect you from discrimination based on gender identity and sexual orientation. You can always ask for the hospital's non-discrimination policy. I think I'm not as well versed in this because, again, this is more of a legal issue. But to my understanding, and after watching this legal webinar on the Fenway Institute, that this should be guaranteed. The only one way that this can kind of be where you can potentially not be protected is in certain Catholic medical institutions. Is that correct, Corinne? Yeah. The unfortunate reality is, I think that it's still hard and should be changing, but thankfully in our area, there's plenty of providers and fewer Catholic-based institutions. I think the only local one is Sacred Heart. St. Luke's itself is not, but Sacred Heart within St. Luke's is still a Catholic-based hospital.
Yeah, so and we had a recent situation actually where somebody was going for surgery, and literally the day of surgery, they were scheduled at a Catholic hospital. And the day of the surgery, they were told that they would not get their procedure because of the Catholic character of this hospital. So, something that's important, this is where you can advocate for yourself, is if your surgeon, for example, has privileges, for example, at multiple hospitals, you want to make sure that they know that you're going to be going to a particular place. So there is a question here about, are there any conflicts at St. Luke's given its history? And so the answer is yes. So St. Luke's owns Sacred Heart Hospital in Allentown, and as part of the purchase agreement, they have allowed Sacred Heart to continue with its Catholic traditions. But any other St. Luke's facility outside of Sacred Heart has a non-discrimination policy.
And I'll say, so Sacred Heart is in Allentown, but St. Luke's itself has a ton of different hospitals within their whole network. And you do not need to go to Sacred Heart at all to get any procedure done. There's no surgeons that, or at least not to my knowledge, there are few and far between surgeons that will exclusively do surgery at Sacred Heart. There's St. Luke's Bethlehem, which has a wonderful surgical facility. There's St. Luke's Anderson. So, going to St. Luke's does not mean you are, it's St. Luke's is not Sacred Heart. Sacred Heart is just a part of St. Luke's. There are a ton of LGBTQ friendly providers within the whole network, myself included. We are actually trying to start a there is the beginnings of a transgender care group. So again, I don't want the name of Sacred Heart to taint, anyone's idea of St. Luke's as a whole, because we are a very great healthcare system. And like I said, there's so many different campuses that it would be, there is no way that you couldn't get what you needed.
Yeah,
you understand
and I think that the main thing is, and because we do have people from outside the local area on this call as well, is that, it's important for you to know your facts. So,
Yes.
if you live in a town with 2 hospitals and one of which is Catholic owned and the other one is not, you want to try to gear your healthcare, if at all possible, towards the one that is not. So,
Yeah.
if you're going to go to the
Exactly.
emergency room, say, I need to go to the emergency room at, Bill's Hospital versus Saint whatever it is hospital.
Right.
And it's important to know that, for example, in this particular case, St. Luke's Health Network, while they have the word saint in the title, they are
Right.
not a Catholic affiliated organization with the exception of this one facility.
Right.
So we'll move on.
Perfect. Next slide. So develop and maintain organization. Next slide. So keep records of your important documents. I kind of touched on this earlier. Contact information of your healthcare team so it's easy to share. And again, as I mentioned, it's helpful if you switch providers. There's also the Cures Act, which was just passed, which makes it very easy for you to access all of your healthcare information. And in fact, it's required that it's easy to access all of your healthcare information. So just put that up there to let you know that you have access to anything you could need. Next slide. So it's important to find your community. While you can do a lot of research yourself, if you have a lot of friends within the transgender community, asking your friends, where have you gone? What have you liked? What have you found that's helpful when navigating the healthcare system? We're here to support each other and make sure we can get the most out of our healthcare. So, and knowing locally, at least, I can't speak for everywhere, for wherever people are, but within Lehigh Valley, there's Lehigh Valley Transgender Renaissance, there's Bradbury Sullivan, and then there's a lot of other LGBTQ positive facilities, including Novus that provides STD care. And then there's also the Allentown Women's Clinic in Philadelphia. There's the Mazzoni Center. There's always apps to connect and find other people like LexApp, or there's plenty LGBTQ specific apps. So, support each other, find your community, and ask your friends what do they do to make sure that they stay healthy. Next slide.
Yeah, and I'll just say that, give a plug to Renaissance. So if you go to renaissancelv.org, we have a pretty large list of trans affirming healthcare providers that you can download off our website. So
yeah,
and you're on it, Dr. Marks, and I just want you to
nice. So speak up for yourself. Next slide. So if it's important to say what it is that you need. My dad's a healthcare provider, and he told me this before I actually, about 15 minutes before this presentation started. The squeaky wheel gets the grease. I think is a good metaphor. So the more you speak up for yourself, the more that you're going to get. So tell administration or the healthcare provider about your gender identity, preferred name, and the pronouns you use, because oftentimes the electronic medical record, this is something that they can put in, and it can be signal to other providers how to correctly address you. It's okay to call out providers for misgendering or using your dead name. And again, remembering what I said earlier, if you legally haven't changed your name might still be in there. So it may not be intentional, it could be accidental. And it's important to ask for exactly what you want, kind of what I talked about earlier, making sure you're writing down a list and saying specifically what it is you need from your appointment. It's okay to trust your gut if you don't agree with a provider. We can be wrong sometimes. So if you question us, it's okay, and we can have a conversation about it. And if not, you can always get a second opinion. Next slide. Finally, I wanted to say, don't give up. I know the system can be overwhelming, difficult to navigate. And again, as I said, it has definitely not been the friendliest to our community. But a lot of people are trying to do better. A lot of healthcare systems are trying to do better. And the only person that loses out is you. If you don't, persist. And that's why, really depend on your community, get the support you need to make sure that you can get the best healthcare you need. And that's all I have for today. I hope that was kind of helpful.
So we'll give people a few minutes where they can start typing in some questions and things like that. But thank you so much, Dr. Marks, and I truly appreciate it. And and I just wanted to sort of chime in myself a little bit on this. Is that so when I first came out to my family practitioner back in the day, it was not a good experience. And even though I'm relatively well off and I'm insured and I'm well educated and I'm an activist, the result of that was that I didn't go back to the doctor for 3.5 years, which is really not a good thing when you're pre-diabetic and overweight and things like that. And so ultimately, I switched providers and I found a provider by working my network, right? Like you mentioned earlier. And so what we don't want to have happen, and I think kind of the point of this conversation is that don't let the system beat you. You need to beat the system. And, a lot of these healthcare networks are really big. And it's like, trying to stop or steer a super tanker. It takes effort and it can take some time, but it's important for us to make that effort because that's the only way things are going to change.
Yeah.
So
I'll also say, sorry. The one other thing I wanted to mention is just because you can't find a provider, like if you Google search, LGBTQ providers through St. Luke's, you might not find anything. And I think it's important to realize why that is. It's because, or I use St. Luke's as an example. It could be anywhere, any healthcare system. You have to keep in mind that in order to be listed as a provider, there has to be marketing that develops a website to make that readily available. So just because you can't find it online does not mean it doesn't exist. So you can call, so for gender affirming hormone therapy, who does that? It's OBGYNs, it's endocrinologists, and some primary care providers. So you can call, the endocrinologist team within your healthcare network and say, hi, I'm a transgender individual and I want gender affirming hormone therapy. Can anyone at the office provide that for me? There's so many ways, and I'm happy to help anyone navigate through this. Again, I'm not, a designated patient care advocate, but I and your friends can also help you through this. There's lots of tips and tricks to all of this.
So we had a question about your thoughts around the National Health Database and questions around getting medical records transferred across providers or shared between providers. So, for example, you have an endocrinologist, you might have a cardiologist, you might have a sports health doctor, and you might have a surgeon who's providing, confirming surgeries. And how do you get them all to talk to each other?
Wait, so what exactly is the question then? How do you get your providers to communicate? Or
yeah, I think ultimately that's what we're looking for. Yeah.
Yeah. I think in some cases it might not be necessary for everyone to communicate with each other. I think it's important to realize that the most important point person is going to be your primary care doctor. Your primary care doctor tends to be the person who focuses on preventative care and making sure it's like the manager of your health, or director of your health, making sure you're getting what you need from all your specialty providers and making sure that there's interdisciplinary communication among them all. If, some providers aren't agreeing with each other or not kind of hearing what's going on. But I think, letting your primary care doctor know who you're seeing is going to be helpful to make sure there's communication. And you can always mention to, your specialist, if you think that there's something missing, you can provide them with other healthcare providers and say, I think it would be helpful for you to reach out to so-and-so to help understand what you can do for me.
And I think
is that helpful?
Yeah. And I think that so I'll just speak, again, as somebody who's married to a healthcare provider. So my spouse gets on average 300 emails a day. and notifications, right? So, her patient went to go see, the orthopedist, and she gets notified, and
Right.
so when you have to go through 300 emails a day plus see a full patient load, it's really hard to pay attention to all that. So again, it's really important for us as patients to raise our hands and make sure we're, making a little noise. We're that squeaky wheel. Somebody here mentioned that, their doctor found out that their local hospital does HRT care, but it isn't on their website. And this just sort of made me think about working with a healthcare network in our general area that where we were saying, listen, we want to be able to go to your website and type in the letters LGBTQ and have a list of affirming doctors come up. And one of their responses was, well, our organization has a non-discrimination policy. So of course, all of our doctors are transgender affirming. And we both know that that's not necessarily the case. But again, it gets into that kind of like steering a super tanker. What I was able to get out of that is, sort of through the back door, a list of about 30 providers who are in fact trans affirming, and then we can share that with our constituency locally here. So let's see here, another one. So I think the question is, are you an advocate or, so I apologize. So I'm not quite sure what this question is, but how do you advocate? How do you create an advocate position? I think it is that creates sort of this communication across providers and across geographical areas. So, you might have, for example, one provider who is in the Einstein health system and another provider who's in the LVHN system, and their EMR may not talk to each other. And this may not be in your wheelhouse. So
one thing is, if you go see a provider, one thing that if the EMRs don't align, one thing that we do is you have to sign, at least at our network, you sign a release of records form. And then, the office that you're going to should send that to whatever institution you got care from that's different from, your primary care's institution. And then they should be able to get those charts within your document, within your chart, your electronic medical record. So there is a way to get it. And again, providing your physician with, the specialist's information, their name and their phone, if your provider has any specific questions about what was done, if it's not clear through documentation. That's the way that we access information.
Yeah. So here's a question. So if you're interacting with a new provider, or really any provider, what would be a red flag that you might indicate to you that they're not affirming and you may want to start doctor shopping?
Well, one thing that you can do maybe before you even interact with the doctor is, again, calling the staff or calling the office and saying, I'm looking for a new primary care provider. Do you have anyone on staff that is LGBTQ aware or affirming or, sees LGBTQ patients? So if the staff knows, then hopefully you won't encounter that once you have your provider. If I think, it's obviously going to depend on the person, but I think, if you find if your provider is misgendering you, which again is not okay, and even after correction, doesn't apologize or doesn't seem to be making a conscious effort to be addressing you correctly, I think that would be a red flag for me. If it seems that whatever you're asking for, you just don't feel like you're being heard. I think, again, knowing that, it is important to speak up for yourself, because it could be that, and this is with any sort of relationship with anyone, people can't read your mind. If there's something that's not adequately being addressed, you bring it up. And then if something's not addressed after you bring it up, I think no matter what it is, LGBTQ affirming or not, if someone's not going to be a good advocate for you or listen to your healthcare needs, I think regardless, it's time to look for a new provider.
Yeah, and so I'll just relate back to my experience, where I didn't go back to my doctor for 3+ years. And then when I finally did go back to them, they wouldn't physically touch me, right? I was there for a physical exam and I don't know how you do a physical exam without touching somebody, but
Right.
Apparently this person is clairvoyant. And, that was like, okay, I didn't get it wrong. I got it right. I need to find somebody else.
Yeah.
And so obviously, not being willing to touch somebody is a pretty good indicator. But you might hear language that isn't real cool. Like, well, I don't know anything about transgender healthcare.
Mm-hmm.
And so the proper response back is well, I can provide you with resources. And if the doc responds back like, well, I haven't got time to be doing that CME, well then there's a red flag. On the other hand, if you walk into the building and you see rainbow flags around and posters that indicate that they're affirming, those are really good signs, obviously.
And there's one other thing I want to add. Realize that you could have an affirming provider, but if the administration is making mistakes, let your provider know, because then your provider can maybe help educate their administration to make sure they're addressing you correctly as well.
Yeah. So
because that can definitely be part of the experience and not feeling safe in your provider's office. So
question here, are doctors being exposed to trans standardized patients in their education?
That is something that we have talked about within our network. I'm not sure where we are. I'm not sure where other networks are. I think that's a great thing to start doing. And I sure hope that that's a thing, but I can't speak to that. I don't know. I hope so.
So that might be, I think
there's a role for it.
That might be when you get your fellowship, something you can work on.
Yeah. Something I advocate for.
But yeah, I think that the last number I saw is that the average medical student gets about 4 hours of LGBTQ instruction. Obviously, the majority of that is related around LGBT issues,
right?
Through all of med school, and
right.
So we need to be working on getting that is a higher priority for sure. All right. Well, we'll wait another minute or two, see if there's another question or two, but we're almost out of time. So thank you so much, Dr. Marks, and I really appreciate it. We wish you the best of luck as you work through your fellowship, and we know you're going to move a mountain or two. So
thank you so much. It was so nice being here. Thanks, Sandy.
So here's one last question. So can a mandatory CME and transgender healthcare be made, for example, so that, all docs are required to do that?
Right. Well, I think you can one thing is, there's the Health Equality Index, which is done by the Human Rights Campaign, where hospitals have to fulfill certain criteria to be LGBTQ affirming and friendly. The list of hospitals that fulfill this criteria is available online, and oftentimes education is an essential component of getting this scoring of being LGBTQ friendly. At my institution, I have done a lot of education, and a lot of that education has been mandatory. For instance, at some federally qualified health centers. So within my institution, I created an online learning module that everyone who works at the FQHC has to complete. And the topic was how to create a safe space for LGBTQ in healthcare. So I think we're definitely moving towards that. My hope is that, diversity and inclusion training for everything, not just LGBTQ individuals, but other minority groups is, a required component to all healthcare. And I think we're definitely all moving in the right direction. Unfortunately, we're not there yet, but I think that's something that we're moving towards.
Yeah. And I think if, there was a message that I heard tonight is that you have to be willing to stand up for yourself, right?
Yeah.
And it doesn't matter if you're a person of trans experience or not. You have to be willing to
Oh,
make a little bit of noise in order to get the healthcare that you deserve. So,
yes. Good summary point.
yeah. All right. Well, thank you so much, Rebecca. We really appreciate your time tonight. And thank you all for coming. Remember, we have more seminars coming up. Just go to patransequity.org/workshops to see what's happening. We have a bunch of really exciting new ones that are going to be added over the next few weeks. So have a good night, everybody. Thank you. Bye-bye.
Bye.